welcome back to the Leftie podcast where we talk about resilience and overcoming challenges. Today I have a special guest, Allie. She's a PT for Bioness, and yeah, I'm super excited to have you on here. Thank you for coming on.
Thank you so much for having me. I'm excited to be here with you.
Okay, do you want to tell us like a little bit about like what you do and like your story and what you practice?
So I graduated from PT school in 2020. So I've been a physical therapist for about 6 years. I started in an outpatient rehab working with neurologic patients. And I actually had a family member or a family friend that sustained a spinal cord injury when I was younger. And I sort of watched his therapy growing up. His brother is my best friend. That's sort of how I learned about therapy. And I was like, I think that that's something I would want to do.
Yeah.
So I actually moved into working with patients with spinal cord injury, seating in wheelchair. And then I used a lot of technology with my neuro patients. And so basically that's how I learned about Bioness. And so after a couple of years in the therapy world, I transitioned over to this role with Bioness now.
For the people who are new to this, I'm also diagnosed with cerebral palsy, and I also did PT and OT from ages 2 to 11. So I also find PT and OT very interesting. So this is how we connected.
So I kind of watched my family friend learn how to function independently. And so that was really, really important to me. And I figured, okay, going into a role like this will kind of allow me to guide people into doing things that they want to do for themselves, no matter what their ability is. What do you remember about occupational therapy growing up? Because you mentioned you did a little bit of it.
Yeah, I mean, obviously it was a lot of like frustration, small wins. Honestly, I could probably tell you more of the frustrating moments than the good ones. But I will say one of the exact moments I remember is because I was obviously one of those girls. I needed like either a stuffed animal with me or like a doll. Like I was huge on American Girl dolls, so I would take my American Girl doll with me everywhere.
I had those too.
And so they had me bring in my doll, and I vividly remember the moment I was able to do a ponytail on my doll or do a braid. I remember braiding. And honestly, it made me gain so much confidence and like so much happiness, I guess, just like being able to like overcome that. And that starts like my milestones of like independence, like learning how to do my hair, learning how to take even it was just the small things that people don't think that are significant. Like we even had to practice like taking off sweatshirts because people like I have to take it off with like one hand because I can't grab both and pull up. Like just small things like that that are such big milestones for somebody with CP or that are trying to overcome challenges like that. And honestly, that's what specifically made me want to start Throw Lefty because you get so many different ideas. I mean, my mom and my dad are on so many different Facebook pages.
I do remember that when I met your mom.
Exactly. She talks about her Facebook pages all the time, but she's on all of them and she's like, I got this new idea of how you could do this, or, you should follow this person on social media. And it made me be like, okay, well, I can share my own personal like ideas and like stuff. So that really made me like gain confidence and just enjoy PT because sometimes you wouldn't enjoy like having to sit in a room and overcome challenges if it's not fun. So my OTs were amazing and they really made it more of like a fun, enjoyable thing rather than sit here and learn how to do it. It was fun and engaging.
I think you sharing your story out loud to other people is really empowering for everybody else. So that's really special.
What's the difference between like empowering and like empowering somebody rather than trying to fix them?
Yeah, I think that's a really good question specifically for the neuro population, right? Sometimes neuro diagnoses are what they are. And instead of calling it a fix, it's more of let me empower you to do these things for yourself in whatever way that might be. There's no normal way to do something. And so I think showing somebody that they are able to do something in maybe a slightly different way is still okay. And as soon as they can kind of meet that goal, then what do we have next going on? And that has seemed to be a really special part of kind of the neuro population. It's showing anybody of a different ability that they have, I guess, the autonomy to do things for themselves that they want. I think that's a big difference between, I guess, calling it a fix versus empowering somebody to do things for themselves.
Yeah. I mean, I feel like you said, like working on the next thing, like I'm sure you've worked with like many different ages. How do you
Right.
like differentiate like how you act towards a younger person versus like an older? Because you're still working against the same things, but like
Right.
you have to treat it in a different way. Like, how do you do that?
Yeah, that's a great question too. I think so. Maybe with younger people, they're not so set in a specific way to do something. So maybe giving them different options. I think focusing on goals is very, very important. You won't kind of get buy-in from somebody. Like you said, therapy should be fun if you're not working on things that they actually want to do. So if it's a sport and you want to get back to some type of sport, like you with lacrosse, or if it's a really, really important task that maybe they need to go back to school or even go to college, things like that, you kind of want to focus on those specific goals. With an older person, it might be, I was doing this and now I can't. And so I may need a different way to learn how to do this. And you kind of go in that direction. I think the common theme is just giving people a way to get to some type of goal that they have in the back of their mind so they feel like they're being fulfilled by the therapy that you're providing.
Yeah. I remember when I was in OT and PT, my PTs they wouldn't reward me, but they'd give me like an incentive. It was actually like marbles, and like it
Yeah.
was like every goal that I reached, they would give me a marble, and I ended up getting like a huge bag of them because like I would be so empowered to like want to do it. And I just remember my collection, and like I never wanted to give them away, but
That's
what
so fun.
yeah, I mean it made it fun. Like it made it like me engaged with what I was doing and
Right.
want to be there because I don't know, I just really wanted marbles. Like I didn't know how to explain it. What do you wish more people understood about long-term CP?
Yeah, I think a big thing would probably be that it is something ongoing, but it doesn't have to be the end of the world. It doesn't have to be the end of independence by any means. I mean, you are a shining example of that, right? The most incredible girl I have met through this job is definitely you. And I think it's just them knowing that they can do more always. And that might mean, okay, maybe we go back to physical therapy for a short bout and we work on joint mobility, or your next goal was I want to play lacrosse in college. So it's like, how do I do that? Do I do it with Bioness? Do I do it with therapy? Do I seek out other things, and just kind of taking your daily life and adding it into things that may help you to reach those goals. So ongoing thing, but knowing that you're able to achieve those goals with different sets of resources and help for sure.
Yeah. And I think that's definitely what would come up in my mind when I try and I'd get frustrated over not being able to overcome a challenge. It's like, I mean, all I can do is move forward. It's not like I can just take it away. Like I can't just take my CP away. But honestly, like I said a million times, like yes, CP is challenging, but it's given me so many more opportunities to like show how you can overcome things. Like there's yeah, it might be difficult, but I can figure it out. Like, and it's really funny because we found out about Bioness, and before you purchase a Bioness brace, you go and you get it fitted and you get all the settings changed. And that's actually what she did for me. That's how we met.
Right.
She helped me with it was the leg brace and the hand brace.
Yeah.
Yeah, right? Yeah.
Mhm.
And it was just so fun. I mean, we just like connected instantly. Like it was just so fun. And it wasn't like a it wasn't like a test. It was like we were having a conversation while we were doing it. We talked about what felt comfortable. And I have the Bioness H200, which is the hand, and the L300 Go, which is the leg. And both have honestly helped so much, and it wouldn't have happened. Like she set up all my settings, everything was ready the second I got the brace and the hand brace. Like it was just amazing. And yeah, like what other devices do you find like that you mainly use with like the patients that you work with?
Yeah, so actually the two that you mentioned are the big ones. So the H200 for Bioness does work to open and close the hand. And that's kind of what Reagan and I started with. And that was a really, really fun time because just sitting there and having this device on you as I turn it on, seeing your hand open was really cool. Like Reagan said, we did connect instantly. You and your mom are amazing. And so we did have a really fun time. And the other device that you have now as well is the L300 Go. So that goes on the leg. It's also a form of functional electrical stimulation. It's really cool, really smart, super easy to put on. And Reagan just puts it on her leg. It helps to lift the foot kind of as you walk and run, especially for lacrosse. And so those are the two biggest ones that we kind of work along with patients with to help set up. And so that was really fun to do that with you.
It honestly was. I was like, I'm chilling. I could be here for a while. Like, I was in no rush. Like, and I just remember because my mom posted on her Facebook page, she was like, and it was just like my face that like lit up the second I like opened my hand or like I straightened it or like after I took it off, I was able to like move my wrist fully. And I was like, I've never been able to do this. Like, it was just mind shaking. And I'm not gonna lie, like sometimes, yeah, I do kind of get insecure about like how my leg and my arm are different. Like in my Instagram posts, like I sometimes would hide my hand and just so people wouldn't have to ask questions or so I just wouldn't have to be insecure about it. But honestly, after using the H200 and the L300 Go, I don't trip as much. Great start. I would always trip in the high school hallways and oh my goodness, it's bad because it's so crowded. But with the H200, I show my hand more in pictures. I'm not afraid to I'm not worried about hiding it because it just made me so much more confident and it just made me so much more empowered knowing that there's devices like this and I can't gatekeep that. Like I need to share it with everyone. Like I need to tell everyone like this is a device that I use and it's made me gain so much ability to do different things.
I think the really cool part of that evaluation that we did together was your fingers afterward. We took the device off and Reagan was like, oh my gosh, my hand is basically completely open and I'm able to kind of maintain that. So for me to see that too, that was really exciting. That's the response that we hope for. And it happened, which was so cool. And then your mom did get it on video. So that was even more amazing.
And honestly, like one thing that I've had to tell myself is it doesn't have to be for a long period. Like I use it 5 to 10 minutes each day, 3 times a week, like as much as I can. Because honestly, it makes my hand tired, but it's me building strength in my arm to eventually have to use it like less and less to gain that mobility. But the more like I start with 5 to 10 minutes, and then the more that I'll use it, the more I can add up the time that I can spend without my arm getting tired or it just strengthening. So, what is the main reason why you think this device would matter to people like who have no idea what Bioness is?
Right, for sure. I used Bioness devices as a therapist in my clinic with my patients with neurologic disorders, and I had seen the benefit even from the very beginning with that. And so coming into this company, it was a really cool opportunity to provide these devices to people that want them and to use them for home. It's a really nice in conjunction with therapy device, but also an extension of therapy as well. And for someone like you who's busy and you're in school and you're about to go to college and play lacrosse, it's a really nice extra to have to keep those brain to body connections flowing, to help maintain your mobility, to increase your strength. All of the good things that us therapists love. It's just an extra piece of technology to progress forward and keep you moving the way that you want.
And I think the main thing is that it at first it was like, whoa, this device like when you bend your leg or you turn on the button, it'll shock you, but it's more just like thinking that like it's exciting, like it's cool that this is happening. Like it's not like intimidating and scary. It's I actually find it really interesting, and that's actually Allie's one of the reasons that I got interested in OT and PT because it's exciting. It's exciting getting to see. I mean, watching my face on the video that my mom got was just eye-opening. I was like, wow, like if I could do this for other people and make other people feel like how Allie made me feel with the Bioness, like I would be so happy. Like, and honestly, that's one of the reasons why the school that I'm going into for OT, and I want to become an OT to help people and make other people feel like how I felt when I tried the H200 or the L300 Go. So yeah, I
It's
mean,
pretty special to work with a patient and friend through this job and then have you say, I really want to go be a therapist. I think that's pretty cool.
what would you say is strong qualities of like a PT or an OT that you've like seen from be working like with tons of them?
Yeah, that's a great question. I definitely think you would make a fantastic OT. You know, being personable, wanting people to get better and kind of that supportive role is a big one. You're positive, which is a huge thing. You make people feel comfortable when they walk into a room. I think being able to sit down and just have this genuine conversation is just a very quick trust builder in kind of my experience as a therapist. And then moving on from there, knowing that you would put everything into helping somebody else to make their care move forward and kind of give them what they need. So I think those are big ones. You definitely fit the script for a therapist. So I'm super excited for you.
Hey, I'm honestly really excited, and it's honestly all I talk about. Like, and now that like I know, I like my mom literally told me from when I was like 12, she was like, I want you to become an OT and PT. Like, I want you to do this. And I'm like, no, I tried vet, I tried a marine biologist, like I did like anything, but I ended up like just everything that I've been through and everything that I've seen and like had to overcome. I'm like, OT is just like my calling. Like, I don't know how to explain it. Like, I just want to help people, just like you're helping people. I mean, like, how long did it take to become like a PT? Yeah.
So for PT and OT, you do have to go and get your bachelor's of science. So that's what you're doing. There are programs, I think, like Shenandoah, where
Yeah.
is it a 6 year program?
3 plus 3. Yeah.
Awesome. So some programs are like that, where you do 3 years of undergrad and you directly go into their grad school program. I did more of like the traditional way, I guess. So I did a 4 year or I did a 4 year undergrad program, and then I applied and ended up taking 1 year off. And then I went to PT school. It's about 4 years smushed into three. I think it's similar now for OT because
Yeah.
they've changed it to a doctorate. So my undergrad degree was in exercise physiology. So I assume if they have for Shenandoah, they'll have a really great undergrad program that'll put you right into
Yeah.
the OT program. But I had to take a lot of science classes. I ended up having to take an extra pre-calc class, which my brother kindly tutored me in because math is not necessarily my strong suit. I really like the science portion.
Yeah.
So yeah, lots of fun science classes, and then you'll get even more of that kind of into anatomy, the way the body moves when you get into your OT program.
I mean, what would you say is like the hardest part of like the entire journey? Like you like obviously it's not smooth sailing like the entire way through school. So like what like kept you like what was the hardest part and then what made you like keep going and like want to power through to learn like to get to become a PT?
Yeah, sure. So I would say grad school is pretty tough. It's a lot of time management, a lot of studying. The biggest thing I learned is just trusting yourself. So you put a lot of work into it, which I know you will. And then you go in and take your exams, and you just have to trust yourself that you'll kind of get through it. Boards are tough, but you'll do it. You'll study and you'll do it. And I think just the motivation to want to finish that degree for the reason of I really want to go into healthcare and work with patients and do what I can is just overtakes kind of all of the other challenging parts.
Yeah.
The challenging parts are fleeting. So it will happen, you'll get through it, you'll be stronger for it, and then you'll come out in OT and you'll be like, wow, I did it.
Yeah, I mean honestly that's kind of what's like empowering me to like want to the get into the accelerated program at Shenandoah and want to become an OT. Like it's just like the thought of just like I said earlier, like help the urge to want to help people and like it's like if I want to get to that point, like I have to push through right now. And that's what's honestly so exciting about like college and graduate school, like you get to do something that excites you, something that you enjoy. And honestly, like in high school, like you're doing everything, like tons of different things, like history, like all of those. And
English.
exactly, like, but in college, like you can do what you're interested in, and the classes that you have will be exciting. And honestly, that's what I'm most excited for, just like the excitement of going to college and getting to do what I like. And then right once I get into graduate school, like I'm actually working for what I want to do outside of college. Like it's just so exciting. Now, like on the other side of that, it's like, okay, like you said, you're gonna have to study, like you're gonna have to like work really hard for it and not give up. Like, and that's kind of what I'm a little worried about. But like it's just knowing the reason I'm doing it. Like, I don't know,
For
it's just,
sure.
but I really want to go because I'm in an early childhood program at my school where I work with 3 to 5 year olds. And
Nice. I didn't know
honestly,
that.
it's just so fun. And like, so I really want to go into pediatric OT
Yes.
to work with like kids, and because I enjoy working with kids, but like being able to connect with them on that level of like, because my biggest pet peeve is sometimes when people say, like, I understand what you're going through. It's like, I understand you're trying to help, but sometimes it's like, I don't know, like, it's just having to put toothpaste on your toothbrush with one hand. It's like it's not the same as being able to hold it and spray it. Like,
Right.
and so being able to connect with kids on that level and being like, I had to go through the same thing. Like, I understand you. Like, I get it. And it's just like just so exciting. And that's what's so interesting to me, that like I can hopefully one day connect with those kids like that.
Yeah, you'll connect on an even different level.
Yeah.
That's a sentence I definitely stay very far away from as a therapist, just because it's sensitive. It's not true. And connecting in different ways and being empathetic or sympathetic towards that situation, you can offer help in other ways rather than saying that. So I'm with you on that for sure.
Yeah.
But I think it'll be really exciting to work with pediatrics. I've worked more with pediatrics in this job than I ever have, and I absolutely love it.
Yeah.
So I'm excited for you.
What would you say, like, let's give like a day in the life.
As a physical therapist, just at baseline, you would work at a facility most likely. So say you want to do pediatrics, you will have kind of a scheduled routine where you'll go in like 8 to 5 or 9 to 4. You will see patients sometimes one-on-one. You will do evaluations and kind of assess what's going on with that person. You then will schedule follow-ups if needed, and you create goals and you sort of take those patients through what's called like a plan of care. So you determine, based on what I'm seeing, how long will I be seeing this person for? What goals are we trying to meet? You gain all of that through your evaluation, but you definitely should still always be evaluating sort of as you go through that plan of care. So you do the same thing as an OT, and then you do document kind of how you used your time with that patient, and then you follow up with them and you continue to progress them kind of through whatever plan you created. And then as things get better, as they start meeting their goals, become more independent, then you do what's called a discharge, where you say, here is exercises, or here are exercises to bring home with you. Always reach back out if you need anything, especially in like the neurologic population, similar to kind of what we talked about before. And then that's kind of the process from like a day-to-day standpoint as a therapist.
What are the moments that like you're like, okay, like this is worth it. Like this is why I do my job. Like what are those like moments? Give me like an example.
For sure. I love the neurologic population more than anything. That is like my heart and soul. Working as a therapist in this outpatient rehab, I worked with a lot of young patients with spinal cord injuries, anywhere from like age 15 to 25. I think the coolest part is the bond that you make with that person right off the bat when you first get there. It is incredible to have a patient that young choose to trust you in some of their hardest moments that they're going through. And I think my favorite part is watching them become almost a better or new version of themselves with now this different ability that they have. And I've seen people just go from the low points to the high points, whether it takes 3 months, 6 months, a year. That is probably my favorite part of the job, and it totally makes it worth it.
Yeah. What do you think that are some things that like patients don't realize about your job?
I would say maybe the amount of volume. Sometimes I think for therapists, it's emotionally draining at times. So leaving some of that at home and just coming in and being as focused as possible. And, we're all human, so that's difficult some
Yeah.
days. But I think the biggest thing for patients is that they don't probably realize how much we learn from them as well. I've learned more from my patients than I think that they will ever know. And I'm so, so thankful for that. I think gratitude is probably one of the biggest things for sure. The little things, waking up every day, being so thankful for everything when you see things that are so hard and people are just still like smiling through it. So that's a really cool thing. Okay, so I guess I should ask the same question to you on the other side. So what do you think that therapists don't realize about your experience in being a patient?
It's a variety of motivation that each kid has. Like sometimes my motivation will be really high, and sometimes I'll be like, I'm really just not in the mood today. I think some therapists like the realization that like you said, like we're all human, like we have other things going on. We don't know what happened. You don't know what happened before the appointment or like what they have to do after, how they really feel about the disability or the challenge that they're going through is something that sometimes therapists like look over just because I mean, some therapists didn't realize like before like I was like I don't want to go. I don't want to have to because it would be tiring for my arm because it's a lot of work for an arm that's a lot weaker. And I'd tell my mom, I'm like, Mom, if I can't do this today, like I'm not gonna like I obviously wasn't able to like word when I was younger.
Right.
Like I wasn't able to express that to my mom, but it's a lot of emotion when you're going through something that you're just trying to do over and over and over and it's just not happening. Like it's either like you haven't figured it out yet or you're just tired that day or like I don't know what it is, but sometimes therapists like kind of look over the emotion of that the child could be going through without being able to express it.
Right.
Because obviously when you're younger, it's harder to say I'm frustrated. Like I was never able to say I'm frustrated or I'm upset. Like I was never able to do that. But now that I'm older, I could be like, I'm really frustrated. Like I can't do this and I really want to be able to do it. It's just therapists like looking deeper into the problem and being like, okay, they can't word it, but their body language and their emotions and how they're reacting to certain things. Like in OT, I had to used to take out the pegs of the pad, you know what I'm talking about? You had to take out pegs one by one with your pointer and thumb, and I would never be able to do it. I couldn't do it. And I would get so frustrated. And I do remember my OTs being very patient with me and being like, it's okay, you can take your break right now, but like let's come back and we can figure out a different way to try this. And instead of having me retry the same thing, they would have me try something different or try it this way, try it that way. Like just the therapist like looking over the deeper emotion that the child has to like overcome. I feel like is
Patience from the therapist as you build resilience.
Yeah.
I think is a big theme.
Yeah, I mean, I feel like a lot of people do tell me like, "Oh, you're so strong and you're so confident." I wasn't always like I'm not I still feel like I'm not I'm like, "What? Like what are you talking about?" Like I mean, everyone has to start somewhere. I mean, it's harder when you're young and you are going through elementary school, middle school, and high school, just being different from everyone and having to overcome that feeling that like, okay, well, I mean, CP, like I can overcome these challenges. I can do as much as I can and just have being able to look over the difference and being like I can be confident in how I am and I love myself for who I am is just such an empowering like moment to where going through PT and OT has helped me so much because it's like, okay, I can do a braid, I can do a ponytail. Like it's just I may have to do it differently than everyone. And that's okay. I mean, that's perfectly fine. And honestly, a lot of people find it very impressive. I mean, people are like, wait, I never even thought you could do a ponytail like that. Or I never even like my friend used to tell me, she's like, Yeah, I was actually really curious. Like, I do it this way. I actually thought about you and I was like, I wonder how Reagan would do this if with one hand, and she would try it and she'd be like, I couldn't. It was so like and then she asked me like, how do you do it? And I showed her and she was like, whoa, like I didn't even think about that. And it was a funny moment. And I was like, just because like you can't do it like everyone else doesn't mean you can't figure out how to do it. And I think that's the most empowering thing I've had to learn.
Yeah, and I think even taking it a step forward, you're now telling other girls your age, actually, you
Yeah.
can do this. Your strength is very highlighted in how you speak and what you talk about. And I don't think everybody has that, but they might now because you're saying it out loud to other people. So that's really, really amazing.
What is one word that like describes your journey through PT?
Ooh, I would say fulfilling. It has been fulfilling and rewarding, if I can have two words.
Yeah.
Being able to support someone in something that's really difficult for them is is fulfilling, and then it's very rewarding to see them kind of meet a goal or get better in whatever capacity that means for them based on whatever ability that they're moving through life with.
Okay. So this is also a funny question, a little closing.
Yeah.
What is the hardest therapy exercise that you've ever had to like give to a patient that you're like, wow?
Oh my gosh, that's a great question. So I really love Pilates. My coworkers and I were doing a lot of Pilates with our neuro population, and we were trying multiple different exercises, a lot of which were maybe in like side plank
Oh,
variations
yeah.
or similar to. And I was kind of like, okay, so I can barely do this.
Yeah.
And so I went home and I've now been doing Pilates for about a year and a half. And I've gotten a lot better at it, but it's not easy.
Yeah.
And I think those types of exercises that are using multiple areas of the body to work on, very, very good for neuro patients and also for everybody else.
Yeah.
I think that was definitely one of the hardest. And I'm thankful to be able to do it so that I know how hard it is. So if I
Yeah.
give it to somebody, I'm like, I know that this is challenging
Yeah.
and we can modify in whatever way we need.
Exactly. Okay, so the final question that I want to ask you is what advice would you give to, I don't know, a 7-year-old just starting PT tomorrow?
For a 7-year-old, I would probably just say have fun. Think about it as playtime or a sport or something that you enjoy doing in hopes that that's sort of how the therapist will run the show so that they feel supported, listened to, they are able to ask questions that they need in whatever capacity that is so that they want to come back.
Yeah. Okay, well, I want to thank you for coming on this podcast with me and making it an amazing episode. I want to thank you guys for listening. All these podcast episodes are to help people with CP or without CP just understand like some of the challenges that we can go through, and somebody with CP and somebody who works with tons of CP patients, what goes through their mind and the therapist's mind. So I do want to thank everyone for listening. I hope you enjoyed. Make sure to subscribe and like this video. Okay, bye guys.
Thanks so much for having me.